Welcome, everyone. Thank you for joining us at Psychology of Rare, PTSD, Depression, Evaluation, Diagnosis, and Treatment. I'm Jill Pollender, the Director of Patient Services at NORD. We are so pleased to have you with us today. As a reminder, your participation in this session means you agree with the NORD Code of Conduct listed on the Welcome to Living Rare, Living Stronger section of the main virtual forum homepage. This session is in the Living Stronger track and was developed with those living rare in mind, but it's open to anyone registered for the meeting. Throughout the discussion, if you have a question, please enter it into the Q&A box you see on your screen. They will be answered at the end of the session, pending time, of course. With us today to present on the topic, we have a fabulous panel. Our panel includes Teonna Woolford. She was born and raised in Baltimore, Maryland. Although she has sickle cell disease and has faced numerous health complications, she is talkative, friendly, and full of life. You're going to enjoy her session, her part of the session. Chris Anselmo. Chris is a Market Intelligence Manager on the Healthcare Partnerships team at the Muscular Dystrophy Association. Chris lives with an adult onset form of muscular dystrophy called limb-girdle muscular dystrophy. This has affected him for the last 12 years. Chris is a patient advocate who is passionate about raising awareness for rare diseases, educating healthcare stakeholders on the power of the patient experience, and helping anyone dealing with adversity, especially newly diagnosed patients navigating the ups and downs of a life-changing diagnosis. I'm looking forward to his session as well. And Deb Ayres. Deb is the co-founder of the Avalon Foundation, an advocacy group providing mental and emotional support to families being treated for rare diseases. She is also a mind-body wellness practitioner for almost 30 years, as well as a mom to Avalon and a patient herself living with a rare genetic disease called hypophosphatasia, or HPP. And Kathleen Bogart. Dr. Bogart is an associate professor of psychology at Oregon State University. Her research focuses on quality of life with rare disorders. She has a rare disorder and serves on the Mobius Syndrome Foundation Scientific Advisory Board. This really is a phenomenal panel. I'm so looking forward to it, and I'll now turn it over to Teonna. Thanks so much for joining us. Teonna, you're up.
Okay, thank you, everybody. Thank you for that lovely introduction. I'm so sorry. I was having technical difficulties and could not see my slides. Okay, so first of all, let me give a disclaimer because I know that it must look incredibly vain and self-absorbed to have 3 pictures of myself back to back to back like this, but I had to do it as a testament to the growth and the journey of mental health that I've been on. So I was born with sickle cell disease, and it affects the blood vessels, the blood cells. I have abnormal blood cells that get stuck in my blood vessels, and it causes the oxygen not to flow properly, which causes a lot of pain and other complications. So by the time that I was 20 years old, I had already faced bilateral hip replacements, liver failure, over 15 operations, and just numerous health complications and more hospitalizations than I can count. So by the time I had graduated high school, I had all these plans to go away to college, and it just wasn't happening. The quality of life that I wanted to achieve just wasn't attainable. So I decided to have a bone marrow transplant. So I went through chemo and radiation and had hopes of curing this disease. And unfortunately, it didn't work. The transplant failed. I rejected. I was in the hospital for almost 5 months, and they really thought that I was going to die. So I had lost all my hair. I had gained a lot of weight from steroids, and that really put me in a dark place. And what I now can look back on was depression. And that's why these pictures are here, because for maybe like 5 years, I was ashamed and I was very insecure, and I did not take any pictures. So for me, I have turned all of this pain into a greater purpose, and I now serve as a sickle cell advocate. And for years, for 20 years, sickle cell, we only had one FDA-approved drug for our disease, which was hydroxyurea. And in the last couple of years, we've had a lot of improvement, and we now have 3 new approved therapies. So what I'm realizing as an advocate is that while we're starting to address some of the physical toll that sickle cell takes, nobody's really speaking on the mental and the depression and the isolation that comes along with the disease. So I am now a psychology major, and I am pursuing a degree in clinical psychology so that I can start addressing some of these issues. And so now I'm just going to go through some tips that have kind of helped me battle my depression. I know for me, one thing that I used to do was I used to suppress a lot of my feelings, and something may pop up. Even though I was born with sickle cell, there are constantly new diagnoses. And even besides the disease, there are real life issues. There are other things that we go through besides our illness. Everyday relationship issues, family drama. And I'm the type of person who wants to just suppress it and do whatever I have to do. I don't want to think about things. So for me, I have this mentor, and her main piece of advice to me is, in order to deal with your feelings, you have to have them, and you have to acknowledge them and not suppress them. And I think another thing that we have to do is we have to allow ourselves some grace. It's not easy living in this world and living in these times, and then adding on having a rare disease or being a rare disease caretaker. That is not easy. So when you have your dark days, when you have your weak moments, be gracious. That's okay. That's expected. It's stressful. For me, another thing that's important is to find outlets. Do things that are therapeutic for you. I know that it's really trendy. You hear a lot about self-care Sundays, facials, whatever. For me, I really enjoy cooking. So that's a picture of my cast iron seafood macaroni and cheese. And seriously, about 2 weeks ago in the sickle cell disease community, I lost about 7 really good friends and tremendous advocates. And it was a huge, huge loss in the community. So that week, like, all I did was cook. And it was actually really helpful, really therapeutic for me. Shopping, that's something that I find very therapeutic. It's not good for my bank account, but it's good for my soul. Journaling is great for me. That's something that I try to implement in my routine. I do that every night and just kind of let out whatever feelings that I have at night so that I can sleep better and don't go to bed thinking about everything. And then this is probably number 1 for me. And I find that in the rare disease community, so many of us are selfless and we have big hearts, which is great. But we have to really put ourselves first. And I say that to the caretakers as well. And this is a picture with one of my favorite quotes: "You cannot pour from an empty cup." And I know that a lot of us are in advocacy and we run our own organizations, and so many times we're caring for other people and we're supporting everyone else, and we forget about ourselves. So I think that's the biggest piece of advice, is to really put yourself first and to remember it's not about being selfish, but it's about self-preservation. And I think that's something that we have to remember, because I remember people telling me, like, to set boundaries and stop taking calls past this time and stop taking meetings on the weekends and stop doing this and stop doing that. And it just, I would tell people that feels so selfish to me, but you really have to do things like that to take care of yourself. So those are just some takeaways and some little tips for how I kind of keep myself sane and how I keep my mental health in check. And I really do believe in kind of the mind-body connection. And what I've noticed for myself is that the healthier I am mentally, the healthier I am physically. So I really do recommend that everybody is really in tune with their mental health. So that's all I have. And now I'm going to pass it over to Chris. Thank you for listening.
Chris, you're up.
Can you hear me?
There you are.
All right. I thought that I was unmuted. Okay, that makes more sense. Hi, everyone. My name is Chris Anselmo. Thanks, Teonna, for the wonderful presentation. So I live with limb-girdle muscular dystrophy type 2B. It's a rare neuromuscular condition that's I've dealt with for about 12 years now. I'm 33 now. For the first 18 years of my life, I had no notion whatsoever that I had a rare disease. It was actually a fluke thing. I was in a car accident, and the blood work that they had run at the hospital, came back that it had these very abnormal results. And after a long diagnostic odyssey, they diagnosed me with, they called it dysferlinopathy at the time, but it's synonymous with limb-girdle. And it was a very weird diagnosis because I had no symptoms. I played sports. I was, active. I had no muscle weakness whatsoever. And then, I went to college. I was, thought that, again, I was fine. And then one day recently after I graduated, I was going for a run, and I noticed some weakness. And I thought that was odd. And then I went to a doctor, and they kind of confirmed my diagnosis and said, this disease is actually going to manifest now, because I had expectations that it was not going to happen until much, much later in life. So, that was difficult, but I was still able to live a somewhat normal life. And then I had my first fall at age 23. So a couple of years later, I was just walking to the grocery store and my knee gave out. And that was kind of the turning point. So, for a while, I was kind of living in denial, trying to live as normal of a life as possible with this condition. But, at that point, I had to kind of confront it. And, the physical symptoms, you kind of understand, it's just going to be a gradual decline, a gradual weakness, but the emotional component was incredibly difficult. I kind of felt my world's kind of crashing down. And, that actually was harder to deal with than the physical symptoms. So, my disease, it's just basically muscle weakness. Thankfully, there's no, heart damage or breathing damage or anything. It's just basically weakening muscles. And I was really struggling to come to grips with that because I was watching my friends and family kind of advance in their lives and in their careers. And then I was just worried about, could I make it to work the next day without falling? So there's just a lot to deal with. And I was really struggling with it for many years. And I I kind of got to a point in 2012 when I just kind of got sick and tired of being sick and tired. And I kind of started opening up a little bit. I started sharing my experience with my family and friends, my inner circle. And then just one day I, just took out a piece of paper on a weekend and I just wrote down all the goals I had for myself and, tried to figure out, which ones could I still achieve. And I realized for the most part, all of my goals and dreams were still achievable. Obviously I had to do them a little bit differently than a, person without muscle weakness would do them, but they were still possible. And it really was a helpful exercise because I realized that I could still live a productive, full life and, wasn't diminished in any way. It'd be different. It definitely would be different from what, a typical life would look like. But, it kind of opened my eyes to the fact that so much was still possible. And, one of the goals I had for myself was to go back to school. And I actually did that in 2014. I quit my job and went full time and to get my MBA. And, through this experience, through gradually beginning to share my story, beginning to open up, I realized, that it kind of found my purpose, that I had, this experience that was very unique, but one that a lot of people could relate to in some way. I was helped by people whose stories, I read when I was struggling, and they were really able to lift me up. And I realized that I could do the same for other people, and by kind of giving back in that way, paying it forward. There's a lot of power in that. So, between starting to achieve my goals and, connecting with other people and helping people through sharing my story, I really kind of felt a purpose that helped to offset some of the emotional trauma of, dealing with this disease. And, today I work at a job that I really enjoy. And I'm very grateful for that. Now, I will caveat that saying that, not every day is easy. There's still a lot of challenges. And anytime I fall, that kind of puts me into a funk for a bit. So it's something that I'm going to just have to live with probably forever. Just this constant battle between, being positive and kind of letting some of the things affect me. But all in all, I feel much better able to deal with that today than I used to. And I really credit just connecting with other people, connecting with great organizations like NORD to be able to, help support me and enable me to help support others. And I think that's really kind of the essence of dealing with a lot of these, psychological impacts of the disease is just connection. Any type of connection that you can make is really, it really makes a world of difference. And that's just something I kind of wished I had learned sooner. So thank you for your time, and I'm going to hand it off to Deborah.
There we go. Okay. Hello. Hello, everybody.
Hi, Deb.
Hi, I'm just waiting to see if the screen is changing. Okay, so hi, I want to thank Jill for the lovely introduction, and I want to thank NORD for all their advocacy and support, and especially for these opportunities to bring us all together and to engage in creating this community. Without this level of support across the board, so many of us would feel so much more rare and alone, and coming together like this, I think really energizes all of us. And that really helps us mentally and psychologically sometimes fill that cup that Teonna was talking about, and to, be able to walk away from these experiences feeling more engaged and more able to advocate for ourselves and more supported. So thank you, Jill, and thank you, NORD. Let's see here. Get my slide up. This is my crazy life, my crazy family. I have a picture here with my daughter, Avalon. Ironically, this was a dinner that we went out to shortly after I was diagnosed a few years ago. And it was, they are the loves of my life. And I feel privileged to share these pictures with you. So, My name's Deb Ayres, and my family lives with a rare genetic disease called hypophosphatasia. And what hypophosphatasia is, a rare metabolic bone disorder, but affects a lot more than the skeleton. And what it is isn't as important in this talk as how it affects our lives. So there is no particular aspect whatsoever in our lives that is not affected by this disease. There's the obvious stuff like our daily routines, our diet, our medical care, our finances, all that normal stuff is affected. And then there's the like not so obvious stuff like where we live, what kind of home we can choose to live in, what kind of car we choose to drive, where we go on vacation, how we travel, how we spend down our finances sometimes, some of our professional challenges at work, and of course, school, IEPs, 504s, those are all the kind of the not so obvious at first. And then there's that subtle stuff that other people don't think about, when we sometimes don't even see, but that greatly is affected as well. Like our parenting styles, our educational choices, marriage, divorce, relationships, friendships, intimacy, even our philanthropy, our politics, everything is affected by this rare disease in our lives. To give you a little bit more background on how HPP shows up for us, Avalon started part-time in a wheelchair in the beginning of her life after she was diagnosed at age 3. And you'll see her there, that a beautiful vampire picture we call when she was age 3. She had been losing all of her teeth. The palate that has a calcium basis does not support the teeth very easily with HPP. So essentially, we don't make the enzyme that delivers calcium to the bones. So the nickname for this is soft bone disease. And so growing up, while the bones are growing, it's affected in a lot of ways, and it shows up differently in each patient. And so we've been considered by the geneticists in the world as one of the rare diseases that's hardest to understand because there's no easy traceability to the way the genetic pattern shows up and the symptoms that are experienced. They can vary very much between individuals. So you see Abby there, age 9, in her electric wheelchair. And that was often what we had to use for school sometimes, for field trips, for grocery shopping, going to the zoo, going to the mall, anything that required her to basically walk further than from, one of the first parking lot spots into a grocery store. If we had to go more than one aisle, we pretty much needed some other way to get her there. So after about age 6, I couldn't carry her anymore, although I carried her for a long time. So that was kind of what showed up. There was a visibility to her challenges that people were basically able to see, but she didn't have braces on her legs or anything that necessarily showed up to explain what was wrong with her. So sometimes I got some looks like, why are you letting your kid play on that electric wheelchair or something like that. So that was an interesting emotional journey for me as a parent. By age 10, you see a picture of her there with an injection. That was her very first injection. And boy, was she brave. She's like, I'm going to do this myself. The nurse was there to show us how to do it. And what we did not anticipate was how incredibly hard and challenging the actual side effects of the treatment would be. But we forged forward and traded up our challenges. So the amazing thing was with treatment, this first ever treatment for HPP, she went from that part-time in a wheelchair to the volleyball court in about 5 to 6 months. So she had never been able to run or jump. I'll never forget, it was day 75 of treatment when she was like able to get this far off the ground, like her heels, the whole foot this far off the ground. It's like, Mom, I can jump. And so she started to be able to run and jump. It didn't look like other kids initially, but she was able to start moving around. At this point in our lives, we had been very well supported by our educational system and by the school we were working with, and we had to change to a different school for a variety of reasons. So we changed to a different school, and this school had never seen Avalon's challenges physically in front of them. They were not visible to them. So they had never seen her in a wheelchair. They had never seen her having trouble walking or struggling with her brain fog, or how great her absences could be from school, whether it was due to her own pain or due to the amount of doctor's visits we had. And so we went into this new school and we tried to prepare them, and she had an IEP and we kind of had it all spelled out, but it was right after this transition of treatment. And so it was interesting because the wheelchair wasn't coming with us, and she wanted to play volleyball. So she was joining the volleyball team, and all of her telltale signs kind of disappeared. And you could just see the school kind of look at us like, you're making this up. There's something not right here. We don't see the problems that you're talking about. At home, we were managing the injections, all the side effects of them. We were managing a lot of fatigue, both brain and body. We were still managing lots of medical care. And she was still averaging 1 absence per week from school, which turns out like 40 to 50 absences sometimes in the school year. So it was very difficult for the administration to understand now her invisible disability. And so we kind of shifted from one set of challenges to the other. And so while treatment wasn't a cure and it didn't actually reverse things, we really had a problem being understood by this school and by a lot of even new people in our lives, kind of just not understanding why this was not showing up if we were claiming it. And it was quite the struggle. And with that struggle, every day, teachers started treating her differently. Students were treating her differently, and the administration was treating her differently. And this built up a lot of troubling emotions for her as an 11-year-old. She didn't understand. She was somebody who was very honest, and people were accusing her of lying, and people were treating her unfairly and discriminating against her. And it started causing severe amount of stress. We went and started seeing a counselor to manage the anxiety that was starting, to manage the depression that eventually set in about halfway through the school year. And every day there were triggers to a great amount of tears, to lots of stress. And we are talking about somebody who always had a smile on their face, who always was very positive, who always wanted to be in school and wanted to engage with people, and was now starting to shut down and feel really dark in life and didn't know what to do with all of that. Luckily, we got some really wonderful help, and we were able to start working with those challenges of having an invisible disability now and identify that as such, and work through that struggle to find the traits we needed to rise above that. Eventually, after grades dropped and therapy was helping a little bit, and we were still working with anxiety, but finding coping skills, we came to a point where we had to make a decision. And Avalon didn't feel powerless anymore. She stepped forward and she said, I think the way that we get through this is that I fight this system. I stay at this school because I never want to have any other child go through this. And if I can break through the system and prove to them how this can work, how they can make this better for kids, we'll make it better for the future. And we tried one last IEP meeting, and we tried a different approach, and we were still essentially not welcomed very warmly. And so my husband and I sat down and we talked to a lot of people that we trusted. We engaged help. We talked with mentors in our lives that could help us figure out what's the best way forward. And what we ended up deciding was to help Avi learn, where the paths in life open are important to look at. And that pivoting from a place in the world that wants to criticize, close off, and essentially cause more stress, and open up to a place that wants to work with us, that wants to explore possibilities and give us every opportunity to succeed was important. And after I went to every school in the area that we could access and interview them all to see who would be able to help us in a way that would meet us where we needed to be, we found a school to do that. And we presented those options. And as a family, we felt that it was really important to look at pivoting away from what wasn't working and pivoting into something that could. We created choices for ourselves that could work. And we found one that worked so beautifully and so well for us. It's actually the program that they're implementing in our district now for all the kids during the pandemic. And they've recently thanked Avalon and said, had you not come to us with this request, we're not sure we could have managed meeting everybody where they're at right now in this pandemic without your program to have tried. And so in summary, I'd say that through these 14 years of living with a rare disease with my daughter, who has modeled and taught me so well since my diagnosis was only a couple of years ago, we've come to learn the importance of finding your own path, finding the path that works for you, finding the path in your life that serves you best, empowering yourself with choices, empowering yourself with helpers, recognizing that all of those things lift you, help you rise into a higher place where you can be. And in taking all of those challenges and finding resilience, finding your grit, recognizing the strength you build through challenges helps you break through and rise to the next place. And so with that, I just want to say, I want to encourage everybody to empower themselves, whether you're a caregiver, a family member, or a patient yourself. Find the path that works with you, because then you get to rise into the place of your greatest potential, regardless of what your obstacles are. Your path is going to look different than other people, but you have clear paths that give you opportunities, and they are based in your own choices. So find those opportunities. Thank you so much for letting me share our story with you today. I will now pass it on to Kathleen.
Hi, everyone. So I'm Kathleen Bogart, and as the introduction nicely showed, my background is that I have a rare disease myself, Mobius syndrome. I do research on this condition, and all rare diseases, really inspired by my own experience as a person with a rare disease, as well as my involvement with the community. Now I'm a psychology professor at Oregon State University. I also just really want to thank NORD for hosting this event. And as you'll see in my talk, these sorts of events are so beneficial to our mental health. So I conducted what I believe to be the largest psychological study on people with any rare disorder. And, you know, this was 1,200 participants who were living in the U.S., and we wanted to see what the commonalities were among the diverse 7,000 different rare diseases that we know of. So we were able to compare them to U.S. population norms, and we found that participants with rare diseases experienced worse anxiety than 75% of Americans and worse depression than 70% of Americans. So, you know, this research of thousands of people rare diseases really backs up what the other panelists have been talking about today. And I really think that this panel is so important because we need to be talking about these mental health issues more. So, more recently, I've been exploring what factors can help with anxiety and depression in our populations. And I want to focus on the two main factors that I've found today, stigma and social support. So, people with fear disorders really experience stigma in a couple of really powerful ways. Of course, we experience isolation because people with rare diseases and their families want to meet others with their condition, but most have never had the opportunity to do so. And there's this strong lack of public awareness, so that there are misunderstandings about our conditions that can lead to fear of contagion. There are people who might blame you for having your condition, or because they've never heard of it before, might even minimize and question the legitimacy of your condition altogether. And this especially happens if you have an invisible condition, like Deb was describing. This leads us to kind of have this burden where we feel like we need to explain our condition to others in order to have our needs met. But of course, that can be quite intrusive to have to explain your medical details to everyone that you might meet, who you might need accommodations from. So this is a constant back and forth that I hear a lot of from our community. And then the other factor I want to focus on is social support. So in psychology, we divide social support into 4 factors. The first one is companionship, and this is sharing meaningful, fun activities with a friend or a family member who enjoys your company. Emotional support is feeling understood or feeling seen. Informational support is getting knowledge and getting good advice from others. Of course, this is very valuable in our rare disease community. And then tangible support is practical assistance with, whatever you might need. So in our community, that might be in getting supplies and medication and helping with housework. So I want you to think for a minute about the kind of social support that you get and whether all 4 of those buckets are being filled and whether you're filling it for others. So 2/3 of people with rare diseases feel they do not get sufficient social support through the healthcare system. So we know this is a problem in our community. So I wanted to study whether rare disease support conferences can be a helpful way to increase social support and reduce stigma. So a couple of years ago, I focused on the Mobius Syndrome Foundation Support Conference. It's much like the one that we're at today, except it used to be in person, and it focused on a specific community. So I surveyed 107 people with Mobius syndrome and their parents. Half of them attended the conference and half of them did not. And we had them complete measures before and after the conference occurred. And what we found was that those who attended the conferences had increased knowledge, increased self-efficacy, increased companionship support, emotional support, and reduced stigma. So all of those really powerful factors that can improve mental health are being given by these sorts of support conferences. So what are my recommendations from the mental health research I've done in this community? to sum up, I just want to have us think about the types of social support and whether we are getting and giving all of those facets. And here are a few domains in which we can engage in that. So, of course, conferences and support groups, and these can be in person, or as we're learning, there's a lot of value to these virtual conferences as well. There's a lot of access abilities that otherwise sometimes cannot occur. Mentoring is another really helpful way. So if you've been in the community a while, helping others who have just gotten their diagnosis, or parents who are just learning about a condition, volunteering to give back to rare disease organizations. And lastly, and very importantly, advocacy. So advocacy directly benefits our communities, and it also can ultimately change our world for the better to reduce stigma. So I want you all to think about some, maybe small ways to get started increasing your social support giving and receiving. And that is all I had for you today. Here's my contact info, and thanks all for your attention.
Well, thank you all. Those were terrific presentations. We do have time for a few questions, not a ton of questions, but let's see what we can handle here. So the first question that we had was sent in: how do you help convince others that you have a disability when it's invisible, when folks can't see it? And so, Deb, you addressed this, so perhaps you want to respond to this first, and then I'll let the others add what they'd like.
Okay, sounds good. Thank you. It's an excellent question, and being on both sides of it's been a big challenge for us. I think what's important is when you start with your inner circle and you make sure that they understand what your needs are, and that you can communicate clearly and you have a safe space with at least the people who you consider your support system. That's a good start. When you go outside of that, starting to very calmly and kindly offer, without offering too much, what it is that you need and communicate that's a good way to interact in public. I'm sorry, and I'm about to say I'm sorry. I try not to apologize for it. That's one practice I do, is to simply politely ask for what I need without needing to justify very much. And if it seems that it's a situation that I need to, especially for my daughter, then I might give a little bit more explanation. But I do try to especially model for my daughter that apologizing for it is something that we try to avoid.
Thanks, Deb. Teonna, would you like to add something to that?
Yes, please. I would just like to speak to that because as I already said, I have sickle cell anemia, which that's something that we say is definitely like an invisible illness. I get all the time, you don't look sick. And just very similar to what Miss Deb said, I think I spent a lot of my childhood trying to... First, I didn't want anyone to know I was sick. And then, very much like Miss Deb was talking about, I missed a lot of school, and the teachers, the administration, they were not understanding. And so much of my energy and my family's energy went into having to prove and justify that I actually was sick. And my doctors were very helpful with that. But I think it's like Miss Deb said, just be very intentional and mindful to educate and advocate as you need, but don't give more energy than you have to. And again, don't feel like you have to apologize or justify more than you need to.
Thanks, Teonna. The next question that we were asked, and this came up earlier in pre-session questions. Can you talk a little bit about PTSD and what those triggers are and what you can do and what your thoughts are on PTSD and having a rare diagnosis? Kathleen, do you want to start?
I'm sorry, dear. I was actually reading a different question. Could you repeat it?
Sure.
Sorry.
Sure. We got asked prior to the session and then also during the session if we could talk a little bit about PTSD and rare disease patients.
Yes. Thank you. I think that's a really important question. I hear a lot of people in our community kind of self-identifying as having medical PTSD, and I am certain that that is a common issue in our community. We have young children who may need to do extensive surgeries and procedures. We have, people who are diagnosed later who are thrust into these sorts of situations. Therapy is an incredible tool for PTSD. PTSD is actually very treatable. So I would encourage people to seek out a therapist who is comfortable and familiar with working with those issues.
Thank you. We also had a question about everybody has ups and down days. How do you deal with that? How do you get to be okay with the fact that not every day is going to be a good day?
I think that kind of goes into some of what I was talking about being gracious with yourself and kind of being realistic with yourself. Like, even just looking in the times that we're living in with this pandemic and just the political climate and racial tension, like, everyone is stressed out, right? And I don't think that anyone is having every day where they're 100% happy and joyful. So, of course, when you add a rare disease on top of that, you're not going to be okay. And I know for me, sometimes I have more pain than others. Sometimes I am more stressed, more anxious than others. And that's a part of it, just simply acknowledging that, hey, today is not one of my best days. And when that happens, I have to be very mindful and very guarded and protective of myself and what I allow into my space that day. Like, I might not be able to take calls from everybody that day. Some people are more draining than others, and maybe I might not want to talk to anybody that day, or maybe I do need to talk to somebody who can kind of pick me up and uplift me. So that's a part of it, just being gracious and acknowledging that.
Thanks, Teonna. Deb, Chris, I know you both wanted to add something. We've got to go real quick, so just last words.
Go ahead, Chris.
Okay. I was just going to say what helped for me was just kind of thinking about it in like a spectrum. So if you can have like 90% good days, or just try to be, happy or confident 90% of the time, like giving you a little wiggle room where if you're having a bad day or you're not feeling great, that you can kind of like sulk for a little bit, but also just knowing to kind of snap out of it in a few days' time, to not let it feed off of itself. I think that's kind of what's kind of helped me. I'm kind of a perfectionist, so.
Thanks for that. So the theme seems to be sort of being kind to yourself. Well, I have to wrap the session up now, but I will pass the questions that we have on to the speakers, and so they may be able to answer those sort of offline. But I want to wholeheartedly thank the panelists for sharing their knowledge, their experience, their stories with all of us. Your contributions to the rare community are so impactful and so appreciated. I'd like to thank the audience for joining us today. I want to remind everyone to access the survey that will be made available to you when this session closes. And the next session starts promptly at 3. So I look forward to seeing folks later on in the day and throughout the rest of the program. Thanks, everyone. Bye now.